everyone, welcome back to our YouTube channel RPIIT Academics. So today we will discuss about the topic that is the neuroses. So here are the objective. First is the causes, sign and symptom, characteristic of neurosis and type of neurosis and treatment of neurosis. So let's get started with the definition of neurosis, a term generally used to describe the known psychotic mental illness which trigger feeling of distress and anxiety characteristics as frame grip with the reality. So next is causes of neurosis. The first is the emotional stress, second is the hysterical stress, third one is the drug interactions. So next, sign and symptom of neurosis, disturbance in the emotional and occupational and social life. And next are the characteristic of neurosis. The neurosis is purely functional mental disorder without the organic reason, a group of the borderline function neuropsychic disorder that manifested themselves in a specific clinical phenomena in the absence of the psychical phenomena. The basis of the neurosis is an internal conflict caused by the insoluble contraindication in the attitude of the person to the reality. That are the sources of neurosis is the social relationship, human relationship and conflict, and wrong upbringing. So next is the more important features of the neurosis are the mental and the physical disorganization, inadequate response and inability to properly react to the different situation, emotional liability, constant internal tension and the anxiety, agitation, discomfort, feeling of the inadequacy, aggression, sleep disorder and sexual disorder. So next are the type of neurosis. So in type of neurosis, first is the anxiety disorder, second is depression, third is the obsessive compulsive disorder, fourth one is the dissociative disorder, fifth one is the somatoform disorder, last is the hypochondriatic disorder. So neurotics are the characterized by the emotional infantilism of lack of the affective maturity, reacting unconsciously in a specific situation. The factor for the neurosis can be as follow: biological factor, socio-psychic factor and the psychological factor. In biological factor, it may be a heredity burden, prolonged traumatic diseases. In socio-psychic, climate is responsible. In psychological factor, psychological traumas, personality trait, emotional shock, stress, etc. are responsible. So in next is the psychoeconomical, social pressure, socio-economic difficulties, material disadvantages, etc. And neurosis include the neurasthenia, fearless neurosis, hysteria neurosis of the compulsive condition, phobic disorder. The differentiation in the conditional, because neurosis is a pure form of the rarely occur, and the treatment is mainly psychological in the form of the moral and journal social support, thought psychotherapy, journal reinforcing procedure and the medication. So next are the treatment. It may be a medical treatment, counseling, psychotherapy, cognitive behavior therapy. So here is the difference between the psychosis and neurosis. In psychosis, insight is absent, and in neurosis, insight is present. Judgment and reasoning is impaired, and in neurosis, judgment and reasoning is intact. In psychosis, reality contact is lost, and in neurosis, reality contact is present. Delusion usually present in psychosis, and the delusions are absent in neurosis. True hallucinations usually present, and the true hallucinations are usually absent in neurosis. And in psychosis, change in the personality may be there, and the changes in the personality is usually absent in neurosis. So next conclusion, are non-psychotic mental illness which trigger feeling of the distress and the anxiety characteristics doesn't lose touch with the reality and stressful life event is mark representing factors. Here are some important references: ICD-10 classification of mental and behavior disorder, Fishes, clinical psychopathy, and this is all about the neurosis. Hope you guys understand. Thank you so much for watching the video.